Jeff Mathews.
Jeff Mathews.
Yeah.
With Zavation. So tell me about your flagship product.
Yeah, Nick, we're a up-and-coming company. CoreLink and Zavation just merged recently. So we took two manufacturing companies that are now together. And our plan is to be the most vertically integrated company in the country. We're very vision-driven for distributors and surgeons, but our main focus is to make sure we give and release products to surgeons that are best for their patients and their practices. So our flagship products right now, we have a huge corpectomy portfolio. We also have our expandable cage, the EasySpan. CoreLink brings on board a lateral technology that is state-of-the-art. We have a new modular screw system that's going to have all the bells and whistles for all surgeons and distributors across the country.
Is there any one product you could show us today?
Yeah, this is our one of our flagship products. It's called EasySpan. We took a very growing market in expandables, and we think we released a PLIF cage that is going to be new to the market and extraordinary for our surgeons and our distributors.
So this is a posterior cage.
Posterior cage. It has a great expanding technology. The smoothness of the cage is what surgeons and our reps really like. We have many different options for our surgeons, and we're going to continue to develop the next stage as we go. That's kind of our focus right now, is what's next, what's coming out, try to step ahead of the game and become a leader and not a follower.
Right. Yeah, that's interesting. I was actually was going to ask you about what's next for the product and I guess your whole line.
Sure. We have we're driven right now to really get a name for ourselves across the country. We're right now redesigning and organizing both systems to contractually integrate with each other, as well as see what products from both companies are really developing the best. Maybe get rid of some of the ones that aren't, but also get the next stage of the game coming for both companies. So we're excited about this. This is a huge opportunity for us, and I think a huge opportunity for the industry.
When? How long ago did?
So July of this year, actually, the merger happened. So we're still into the beginning stages of transforming everything over and becoming one family. So we have a good team. Our staff came over from CoreLink, introduced our staff with the Zavation crew, and it's been an absolute awesome experience so far. We have a great team of very experienced leaders, product management, training facilities at both locations. So the really unique opportunity right now, there's many companies out in the market right now that say they're a manufacturer, but they don't manufacture instrumentation. We do everything in-house. Everything the surgeons use and touch and feel, we make in-house in the United States.
Is there one location?
Great question, Nick. We have two locations now. We have a 75 square foot facility in St. Louis, Missouri, which is a 45,000 square foot manufacturing plant, as well as a full cadaver, 3-station cadaver opportunity with state-of-the-art beds, state-of-the-art lighting, video. We can do training. Surgeons can come in and do cadaver labs. But also Zavation in Flowood, Mississippi, which is right outside of Jackson. We do all the manufacturing as well there. We do all of our synthetic bone there. We do the kyphoplasty balloons as well in-house. So it's a real cool experience. If you've never been to a vertically integrated manufacturing where you're taking raw materials and bringing them to market for the surgeon to use, it's a cool experience.
You mentioned training for a second, and I was interested to find out what process you use to train surgeons and that sort of
so we have a marketing team that is absolutely amazing. Every year, Claire Strand is our medical education director. We will hold 5 or 6 rep training labs throughout the year where we'll get all distributors from across the country and kind of give them a focus date to where they can come to St. Louis or Jackson. We'll do a 4 to 5 day training lab to where we come in, train the students on all the products, but also we do hands-on, full cadaver opportunities, and usually have some kind of test at the end to make sure we have a qualifying candidate to where we give these reps and these distributors a product back to their company that is good for the industry.
Are there any products in particular that are are in the near future that are part of your innovation?
Yeah,
portfolio?
we're really expanding our lateral field right now. We have retractors. We have a state-of-the-art retractor, 3D printed retractor. One of the things that this company is really known for is our 3D printing. So we have the lateral space that's going to be expanding. Expandable laterals are going to come out very soon.
Okay.
But our main focus right now is trying to developing a modular screw system that's also a degen system, but we're going to have the capabilities of doing finished rated screws, MIS screws, modular, monos. We can do the whole kit and caboodle to bring these sets into the OR so a surgeon can go in and do an open case, but also do an MIS case if he wants to. So
okay, interesting.
I think what we did with both companies were developing a product, and so we were merging those two ideas and hopefully giving this industry something that they've never seen before. I've been with CoreLink for 10 years.
Yeah.
I was a vice president of sales for CoreLink for 10 years and merged over with Zavation, so this is all fairly new, but the cool thing is I'm from Mississippi.
Okay.
And so I've known the Zavation guys for a long time. They're absolutely amazing. Jeffrey Johnson started Zavation years ago, and so we're in a developing stage right now to where we don't want to just release a product to the industry. We want to follow the product, follow the surgeons, be a part of their family, be a part of their industry, and help them build their practices to where they want them to be.
Okay, so it's more like an emphasis on the networking of the surgeons with the company then?
Sure, yeah, we like to network with the surgeons, help them, understand our practice, show them how we make our products to allow them the confidence that they can go back to their patients and say how well these guys do what they do.
You think that's something that you see as differentiating for Zavation?
I think it's very different.
It's not something I'm familiar with.
Yeah, it's a unique opportunity. We do all of our final finishing. We do molding handles. Everything is all under one roof, or actually, both in St. Louis and Mississippi.
Okay.
But that's something that's unique to this industry. And as you walk around these booths and these companies, you can tell and see where the companies are going and kind of where their stages are in their productivity.
I can see you have some animation content here.
Yeah.
That's one of the medias that you use to market with?
Yeah, we have a great marketing team. We do a lot of animation. We like to release our tech guides, all of our surgery situations to where we can give these guys, our reps and our surgeons, a cool game plan before they go into surgery.
Okay.
So they can kind of watch our videos and look online that you can do some of our tech guides to help train your reps before you actually get in there. So, one part of being successful is preparation. And we feel like we're in a preparation stage right now that is on the mark to be something really great.